tongue, muscular organ that lies in your oral cavity partly and partly in the oropharynx, and it is meant for articulation, mastication, deglutition, and definitely the taste. It has got the dorsal surface and the underlying ventral surface, and we then name them as superior and inferior surfaces. This is the lateral view to show you various parts of the tongue. There lies the apex, which we call it as the tip. Then we see the body of the tongue, and then we find the root of the tongue that is attached, right? The tongue has anterior 2/3 portion and the posterior 1/3 portion, and they are being divided by the sulcus terminalis, and at the V of the sulcus terminalis there lies the foramen cecum, and it represents the remnant of the proximal part of the embryonic thyroglossal duct from which we get the thyroid gland, right? Again you can see the green color sulcus terminalis that is gonna divide the tongue into the anterior 2/3 part, which is oral, and the posterior 1/3 part, which is pharyngeal. And what else you see? That there lies a median furrow present over the dorsum of the anterior 2/3, and its mucous membrane is roughened due to the presence of various small lingual papillae, right? The posterior 1/3 is marked by the lingual tonsils. What are they? Basically here, no lingual papillae are present, but the lymphoid nodules give a cobblestone appearance to your posterior 1/3 of the tongue, and hence forming the lingual tonsil. And if you see that the most posterior part of the tongue, which is called as pharyngeal part, is gonna contribute the interior wall of the oropharynx, right? Now we have to talk about the most posterior part of the tongue that is attached to the epiglottis through 3 folds, right? Let me tell you that the median one among them is the median glossoepiglottic fold, right? Then we have to mention that there lies 2 lateral glossoepiglottic fold, and in between these two there lies a depression on the both sides called as vallicula. And then we see that the lateral fold is supposed to separate this vallicula from the piriform fossa, right, which lies here. Now the lingual papillae, there are 4 varieties we have to observe here, and you can see among them that there lies the vellet papillae present anterior to the sulcus terminalis. They have got the flattened top and having, we should mention, circular trenches around them, and the duct of the various serous glands are supposed to open into these trenches, right? And now you have to concentrate. Then there lies another variety of the papillae called as foliate papillae. They are present along the lateral margins of these lingual mucosa, and in the human they are poorly developed, right? And now we have to focus on the filiform papillae, right? These are long, numerous, and are related with the afferent nerve conduction and very sensitive to touch. They are showing conical projections directed backward, scaly, and we find them that they are arranged again along the terminal sulcus and on the dorsum of your tongue. Now what else you would see? There lies the fungiform papillae, which are mushroom-like shaped and scattered among the filiform papillae and most numerous near the margins and apex of the tongue, right? Now here lies the taste bud, which are buried in these papillae. They are well laden with the 3 varieties of the cells: the basal cells, the sustentacular cells, and the gustatory cells. This is the inferior surface of the tongue, in which you can see the midline frenulum, and on the adjacent side of it there lies two deep lingual veins, right? And you can see that there is the curved plica fimbriata on the adjacent side of that deep lingual vein. And concentrate that near the base of the frenulum you can see the sublingual papillae, and they are showing the orifice for the opening of the submandibular duct that is coming from the submandibular salivary gland, right? Now, muscles of the tongue. These are 4 extrinsic muscles and 4 intrinsic muscles. First of all, extrinsic muscles. You can see the genoglossus, which is marked in blue color. It is attached to the mandible on the genial tubercle of mental spine of the mandible and up to the body of the hyoid bone, right? Then in the green color, the muscle lies the hyoglossus. It is attached from the body and greater horn of the hyoid bone. Let me mark it. And then it is attaching on the undersurface or inferior aspect of the tongue, right? Now you can see the purple color muscle that is attached to the styloid process, hence called styloglossus, right? And is attached to the sides and the tip of the tongue, right? Then you can see the yellow color muscle, which is called as genohyoid. It is attached to the hyoid bone and up to the mandible, right? It is just like a strip. Now you can see another muscle named as palatoglossus, that is just like a narrow crescent shaped one, and being even a palatine muscle, it forms the posterior column of the isthmus of Fauces, and where it is attached to the palatine aponeurosis, and now blending with the intrinsic muscles like transverse muscles of the tongue, right? The main action of your palatoglossus muscle is to elevate the posterior surface of the tongue, or it can depress your soft palate and acts to constrict the isthmus of the Fauces, right? And what these rest of the muscles do? The genoglossus, which is marked in blue color, has to depress your tongue and create a central longitudinal furrow. And what else it has to do? It pulls your tongue anteriorly for protrusion, right? And what else? It's being called as a life-saving muscle because it helps to pull forward the posterior part of your tongue and protrude it forward, right? Now the purple muscle, the styloglossus, it retrudes your tongue and can curl its sides, right? Like in elevation, and can form a trough during swallowing to eat up the bolus, right? Then the green quadrilateral muscle, hyoglossus, it depresses your tongue when contraction is there and pulls the sides inferiorly, and it also shortens the tongue or retrude it, right? Now about the yellow color genohyoid muscle that is attached in between the mandible and the hyoid bone. It pulls the hyoid bone upwards during swallowing, right? Now the intrinsic muscles of the tongue. You see the tongue from the posterior aspect, and what are they? They are the superior longitudinal and inferior longitudinal. They are present along the submucosal fibrous layer and root of the tongue and body of the hyoid bone where they get their attachment up to the margins of the tongue and apex of the tongue along with the mucous membrane, and these as being lying longitudinally. When the superior longitudinal constricts, what happens that it makes or curl the tongue upwards, so elevating the apex and sides, and helps in retruding or shortening the tongue, right? Let me mark its shape. When it contracts, it gives the concavity upwards, right? And let me show you that when the inferior longitudinal muscle constricts, what happens? It also now gonna do what? It depresses your apex of the tongue, and what shape it will be attaining? Now the concavity is downward, so we learn it that being the depression of the apex, it also causes the shortening of your tongue, right? Now the transverse muscle and the vertical muscle. Transverse muscle, as you can see, is also present along the median fibrous septum up to the lateral lingual margin. Let me mark it that if it is present at this place up to here from medial to lateral, when it contracts, what is going to happen? That they will allow the tongue to become narrow and elongate, so helps tongue to protrude, right? And what about the vertical muscle? Let me mark it that this vertical muscle is present along the submucosal fibrous layer of the dorsum of your tongue and up to the inferior surface of the borders of the tongue. And when it is gonna contract, so what is gonna happen? Let me mark it extent. You can see its contraction causing the flattening and makes the tongue broaden, right? Now about the lymphatic drainage of the tongue. The lymph nodes, you can see that your tip of the tongue is being drained by the submental lymph node, and the lateral aspect of your tongue is being drained by the submandibular lymph node, and the central medial part is drained by the deep cervical lymph nodes, and the posterior one third is also drained by the upper deep cervical and the retropharyngeal lymph nodes, right? About the nerve supply of the tongue, all the muscles of your tongue are being supplied by the hypoglossal nerve except the palatoglossus, which is the palatine muscle, and being supplied by the pharyngeal plexus, and we know that this plexus is formed by the 9th and 10th cranial nerve. And now for the general and special sensation, we have to mark up that the interior 2/3 of the tongue for a taste sensation is carried through the chorda tympani branch of the facial nerve, right? And the general sensory supply is through the lingual nerve for the anterior 2/3, which is a branch of trigeminal nerve, right? Then we have to see that the posterior 1/3 of the tongue, here the sensory and taste fibers both are running through the glossopharyngeal nerve, right? And we can see that the most posterior part is being supplied by the vagus nerve as a whole through the internal laryngeal nerve, right? Another thing that the circumvallate papillae is also supplied by the lingual branch of the glossopharyngeal nerve, both again for the general and special sensations, right? About the vasculature, you can see that the external carotid artery is going to give rise lingual artery and the ascending pharyngeal artery, right? They are going to supply your tongue, and root of the tongue is being supplied by the tonsillar branch of a facial artery, right? And the arterial supply in which the lingual artery is there, it has to pass deep to the hyoglossus muscle, right? And dorsal lingual artery supply the root, and the deep lingual artery are supposed to supply the body of the tongue. And now what about the venous drainage? The dorsal lingual veins and the deep lingual veins, they are joining to form sublingual vein, and finally they are getting into the internal jugular vein, right? Now a little bit about the taste sensation. In the picture we can see that the sweet and salt taste is perceived near the tip and the lateral aspect of your tongue, and the margins are taking the sour taste, and the bitter taste is perceived near the I would say posterior region of the tongue, right?